Yeah, microsurgery, when we're talking about ophthalmology, you literally have someone's vision. You have their sight in your hands at your fingertips. Most people, I think the hallmark of a really good surgeon, like a maestro surgeon, is an onlooker or someone who is not an experienced surgeon or someone who's just a layperson can look at that and say, oh, that looks pretty simple. Like you watch Bill Wiley, you brought up, Bill is, there's I'm fortunate to have worked with a lot of really good surgeons. I've worked with a lot of really great surgeons. I've seen phenomenal surgeons at work. There are a few people that I would put at like God tier level in terms of surgery skills, and Bill is one of those people. You just watch him and do cataract surgery in 4 or 5 minutes, and it's just exquisite. The interplay of his fingers, the instrumentation, everything is happening the first time when he wants it to happen. And I have to tell people because we have so many visitors, medical students, fellows, residents coming from out of state or industry comes in and they want to see something. And when I'm narrating, I have to really emphasize to them, this is not typical surgery. This is surgery at the highest level. I mean, this is like watching Roger Federer play tennis or
Right.
Tiger Woods play golf. This is like the pinnacle of what surgery looks like. And people forget that because surgeons have become so good. We can do cataract surgery in 5-10 minutes. Before it used to be 30-40 minutes. You used to be admitted to the hospital, have to stay overnight for multiple days. People's eyes hurt. At some point, we weren't even putting in intraocular lenses. And to your point, you were bringing up the progression of technology, the advancements we have. Things have gotten so good. It's really, really hard to appreciate, I think, unless you yourself have been in the trenches, have seen what can go wrong, have experienced
Absolutely.
complications. So like I'll see, Bill in a situation sometimes and people will be like, oh yeah, that was supposed to happen. And I'm like, you don't understand the amount of skill that went into that 1 second maneuver because everything we're operating within millimeters,
Of
right?
course.
2 to 4 millimeters, sometimes less than that. And it's the slightest depression of the heel of your hand or the slightest movement left or right. There's just so many exquisite things at play. And the pressure, I don't think most people realize sometimes until like for me, it was at the end of a surgery day. I'd be like, all right, it's like 3, 4 p.m. We did a lot of surgery. Why am I so tired? Like I got a lot of sleep
Yeah.
last night. I'm hydrated. I'm caffeinated. It's just you're so focused. Your entire being is focused on taking care of that patient, restoring their vision, taking care of their sight, enhancing their ability to see. And that takes a lot of pressure.
Yeah. No, you don't realize mentally how taxing the whole thing is. Absolutely.